right, we're back with our second debate. Thank you all for all the comments and engagement that we got. We're back and we're going to keep on doing these. Hi, Yara. Hi, Omar.
Hi, Omar. Hi, Omar.
How you doing?
Good. We're about to invest some money. We have a lot of money coming in. So like we said last time, today's question, it's not as much as a debate as much as it's your opinion and like thesis as an investor. I wanted to ask you guys today to invest $100 million in healthcare in either Egypt or the MENA region بشكل عام. فنبدأ بعمر Zaki. If you had $100 million, how would you spend them on the region in health tech today?
There's a lot of obviously kind of areas that the money should and would go to. I think, Annie, my first take would be to divvy it up around kind of some initial fundamental training and education needs, equipping and enabling the workforce to be able to handle the new technology and the new capabilities that we can bring. And I think another portion of it would be, specifically around solutions that can help start the shift from contagious disease and accidents, right? Workplace accidents to actual like management of chronic conditions and preventive medicine. So it's those things like digital therapeutics, like remote patient monitoring, like, wearables and other technologies that we can start to test with. But really, we still have to work a lot on the fundamentals and kind of just the know-how and the common language and, the understanding of technology standards, right, that need to be in place.
What about telehealth? Would you invest in telehealth again?
I definitely would invest in a portion of it in telehealth. It's my passion. It's where I started my career. And I think that there's still a tremendous amount of opportunity in the market to develop more telehealth solutions. So, I definitely would have a portion there.
Awesome. Excellent choices. A lot of similar choices between us. So, Yara, how would you spend your money?
100 million.
Yeah,
not much.
Buy a penthouse.
So a Rolex watch. I think it's like hard choices. A lot of things are still needed within Egypt and the MENA region. But I would think in two terms, something that is like of a more guaranteed ROI. So you would look at things that increases access. So on-demand models, telehealth, of course. There are a lot of those that came up in the past few years, but still that doesn't cover like not even like 3% of the needs that we have. So that would be like my first choice and possibly half of the money that I have. And then my second choice would be investing in women's health. I think there is a massive opportunity in women's health. There isn't really a lot of focus in the region, specifically when it comes to anything related to femtech. I think in the whole region, we have like, I don't know, like 2 or 3 startups. So a lot of education and a focus on early stage investment is needed there. But globally, like the whole world is now looking at investing in femtech and the amount of money that is going there is rising exponentially. And I don't know, women are half the population that are hiding in plain sight, and we're kind of missing the opportunity there. So yeah, my other half is going to go to femtech.
Awesome. And when you say femtech, it's companies that are addressing women's health rather than companies run by women, because that's also an area that we need more of. Okay.
Yeah, so companies addressing women's health. So like the obvious ones, of course, are like the period trackers and all of the things that has pink ribbons on them. But then you have much more than that. You have things that look at fertility, things that look at like the whole pregnancy like care model. You have things that look at primary health care, like so much stuff there.
Yeah, very important for men and women alike, actually. And I'd like to see a lot of money going in there. Very interesting choices. resonate with both. I think what I would add, Omar, what you said in the beginning about like preparing the workforce, I think is very interesting. From my perspective, I see a lot of electronic medical records, especially in the UAE and Saudi Arabia now happening. And I'm getting asked to like do these trainings for doctors to help them with documentation. I think that job, as much as I'm gonna, I'm taking these jobs now because I need them, but I think that job should be extinct within 5 years, and no one should pay me to help a doctor document, because there needs to be a lot of automation in that. Like, we're talking about Health 3.0, helping doctors have a smooth time with like electronic medical records. And the problem is we're going to probably invest in the region in the same electronic medical records that are now causing all this pain in the States. So I would definitely put a lot of automation in EMR. I also like spend at least 25% of the fund in AI and workforce multipliers because of the ratio between doctors and stuff. But then the last half would probably be also a mix of like chronic disease management, but also like, focused on verticals. Women's health is a very interesting one, I think, as well.
Yeah, Omar Shaker, what about wellness and burnout and stress management?
Yes, actually, so that part of it would be relieved with documentation and helping the stress that happens from technology. But that is a very interesting point. I think if we look at the wellness industry, we're still like the profit that's coming out from the Middle East is still very low. But when we look at consumption of remote tracking and people like that, I think I saw some studies that the likelihood of people in Ramadan, just this last Ramadan, there's a statistic about the wellness apps being used much more and people more interested in it. So definitely seeing that, like I see people also running around Cairo all the time, which is not something that we used to see a lot of. So I think you're spot on. I would put $15 million, maybe $10 million. Yeah. أبو بلاش كتر منه بقى, we can spend it.
Yeah, I would say definitely the wellness is important, and it still relates to, I think, the fundamentals of education and messaging. I think if we just improve the awareness around simple things in life that create wellness and prevent big issues and risks, you're seeing that transition happening now. You're seeing the influence of fitness in Egypt, and kind of people now more and more going to the gyms, or more and more spending time to be ready for Sahel, right? So I think these things, as we kind of continue pushing more awareness and education on why it's important to try to stay well and prevent the conditions that happen, we'll see that. And if there's creative solutions, right, that don't necessarily rely or depend on expensive technology that is unfortunately not distributable in Egypt right now, or to a large part, what are those? What's a creative way digitally to inspire millions to get up and bend over more than they just do in prayers, right? So that they can feel a little bit more healthy, right? I mean, again, I'm just spitballing here, but there's got to be creativity out there to leapfrog the cost of technology.
But one other question back at both of you guys. What about personal health records?
I'm a big fan. I just think it's a big road still that has a lot of complexities and security issues that have to get figured out before it can kind of become more widely utilized. But that's just my view. I'm definitely a big fan, and I'm tracking as much as I can. I think blockchain is a big part of that.
Yeah, and I see a lot of interesting companies, but I don't see a lot of incentives in Egypt, for instance. But maybe in a place like Abu Dhabi, it'll be a little different. But I think it's something that's going to come inevitably. So I agree with Omar too. I have a suggestion for next time's topic, since it seems like we all lit up with Yara's question about wellness. How about we talk about the wellness bit next time?
Awesome.
That's our topic.
Yeah.
What are the next trends in wellness that we'd like to see? The most important ones, so that it's a bit of a debate.
Definitely. Looking forward to it.
Awesome.
All right.
Thank you so much.
Good to see you guys again.
See you in 2 weeks.
Talk to you soon. Bye.